So, Colleen, can you give me a brief overview of your organization and what you do?
Yeah, absolutely. So Cure SMA is the health organization for spinal muscular atrophy. So our whole organization really is dedicated at research on the disease as well as care and support. So we do everything from funding research to organize conferences for medical providers, for researchers, and then most importantly for the families. And so we organize events for families, we organize conferences. We have an abundance of support programs available for families right from the moment they're diagnosed all the way through, adulthood and adults with SMA as well.
So, you're caring for, I would assume, mainly high risk people, right? I guess people with SMA are at high risk of COVID-19. So, how do they cope with like all those, anxieties and uncertainties?
And being quarantined. And
Yeah.
so, like many other diseases, SMA families are accustomed to being quarantined. We're often quarantined for the whole flu season as it is. So there's good and there's bad with that. So I think that they were ready, from the get-go to be quarantined. They've been quarantined. They've been doing a great job staying home and staying away from germs. The bad about that is there's a lot of families that have been quarantined since flu season started, and spring is when they're supposed to come out. So that's very difficult. But SMA families are so equipped to handle this, and I think they've handled it a lot better than most people because they are used to needing to stay away from germs and take care of themselves and their families.
Yeah, I feel like this.
Yeah,
This is the same for many people with chronic illnesses because we have that kind
exactly.
of resilience already, right? So
Exactly. You're exactly right. Yes. Yes. I mean, it doesn't, there's still high levels of anxiety. And obviously, it's so stressful for anyone having to stay home, especially for such extended periods of time and socialization of it and, children. And there's so many aspects of how this is just so difficult for so many.
So, are there any specific ways how you protect your members? Can you tell me a little bit about that?
Yeah, we give frequent webinars about trying to stay safe with COVID-19. We've done a great job with that. We just had another one for newly diagnosed families last week. We're holding another one this week. So we give them constant education. We have great resources on our website as well. One of the biggest things that we've been really excited about is we're offering all of our families, all the SMA families and individuals with SMA have the opportunity of receiving we call it our COVID-19 support package. So we're sending them antibacterial wipes, antibacterial gel, tissues, different adult coloring books and things to keep people occupied. We have things in there for kids as well. So we've already sent out well over 1,000 of those. And they keep coming in. We're expecting we'll probably send 2,000 to 3,000 by the end, which is very exciting. And then we are also providing our families through wonderful sponsorships, gift cards for grocery stores and restaurants. So which will just help them a little bit as well for being home.
So, how did this whole pandemic affect your work as an organization? What changed?
Yeah, a lot, everything, as with most. We, for one, as I mentioned, we have a huge annual conference every year where we have people coming from all over the world to attend. So canceling that was big for us. It's very sad. We put in a lot of work, and a lot of families love attending this conference and researchers. So it was hard to cancel it, but we obviously didn't have a choice. Our number one commitment is to our families and keeping them safe. And then all of our one-day conferences all over the country have been canceled as well, many months of them. Beyond that, we really have been great at not skipping a beat. Right from the get-go, we went home, the employees, and we all took packages with us, and we're shipping information out from our houses. We have a great team who have, been able to get to the office one by one, to be able to ship things out, things that are needed for families, equipment, care packages, anything that they need. We have still been able to get them right away. So thankfully, we haven't had a huge lag.
And how, or did you get any feedback from your members how this pandemic has affected them personally, like their access to healthcare or any other big challenges they face?
Yeah. Yeah, our biggest concern has been people missing treatments.
Mm-hmm.
It's very important that obviously all of the families get treatments. Obviously, it's understood that there's going to be some delays, but we really don't want people to miss their treatments, which are so important. So that's probably been the biggest way. Obviously, it's hard for families to even get to grocery stores. Families don't want to leave at all. They don't want to expose any of their family members to COVID-19. So they've really been struggling with trying to make sure they can get things delivered, keeping people away, trying to keep doctor's appointments, not attending some doctor's appointments, even though they should. They've been really worried. So I'd say that that's probably the biggest way that it's affecting them right now. It's just trying to stay away from trying to get COVID-19.